Okay, well, I am going to get us started. We have a very exciting session today, and we're so happy that you all are here for um, I don't even know which one this is, but one of many UCLA Rapid, Rigorous, Relevant Implementation Science Hub Beachside Chats. I join you from this virtual beach. I'm Allison Hamilton. I lead our hub, and I'm so excited about today's session. Thank you again for joining, and in advance to all of our folks who have joined the panel for a really exciting session. So I'm just going to cover a little bit of introductory information, and then we'll get to the heart of our topic today. Okay, so we have very exciting guests today, uh, and I'm going to be gladly listening and absorbing a lot of information and insights. This beachside chat today will be moderated by Dr. Tammy Loeb, who is one of our hub co-investigators, and Ms. Elena Rosenberg Carlson, who was with the hub for a long time and is still very much attached and associated with us. And so we're so happy that Elena was able to join and co-moderate for today's session. As you may know, and I hope that some of you are, really pushing what's happening with social media strategies in HIV related research, other types of implementation research. But what we've found, especially bringing folks together from our hub awardees and team, is that there's very little practical guidance about how to use these strategies, what they look like, how do you formulate them, deploy them, et cetera. And several members associated with our hub formed a community of practice on this topic and have been very productive and have really enjoyed sharing their insights. And so we thought it would be great to bring a few of the PIs together from their respective projects that are using social media strategies to engage in this beachside chat today. So our topic is the power and pitfalls of social media strategies, lessons learned from implementation science. Oops, sorry. Efforts to end the HIV epidemic. And our featured panelists are Ahonkhai and Jane Lee. Raquel Hernandez had a last minute conflict and won't be able to join us, but she's very much been part of preparing for this. Um, so for anyone who has not joined a beachside chat, the format here is really meant to be a chat with everything that that might imply about being informal. This is really meant to be a dialogue. Elena and Tammy are going to get us going with some prompts and some discussion points, but we very much look forward to the audience's comments, questions, input, etc., by using the chat. We are going to record for now. This session, we do typically record our beachside chats and post them on the YouTube playlist where almost all of our activities and offerings are available. And I'll show you that link at the end. So we have a wide variety of methods, workshops, as well as many, many, many beachside chats that we've done over the years. However, we may decide at some point during the beachside chat that we want to turn the recording off, and we can do that if that's going to help people to feel more comfortable. So we'll see how it goes. This is a very open plan, and we really do want to have a good, solid, in-depth discussion and want everyone to feel comfortable about being able to do that. So with that said, Tammy, Elena, any other setup that I'm forgetting that we need to mention? Okay. So I'm going to stop sharing the slides and we can chat. So thank you both again for being here today.
Thank
Great.
you, Allison.
Thanks, Allison.
Thank you.
Well, as Allison mentioned, we're delighted to have a couple of amazing panelists with us today, Jane and Ima. We wanted to just get started with asking each of you to share a bit about your project and how you used social media strategies. So maybe we can go ahead and start with Jane.
Yeah, so hi everyone, my name is Jane, and I worked with an amazing community organization in Seattle, Washington called Entre Hermanos. And our project had initially really developed several years ago in 2021 when we had developed and piloted some social media content specifically for Latino, gay, bisexual, and other men who have sex with men, so Latino MSM. And we were wanting to evaluate our campaign to see how it engaged the population, but also to assess whether the campaign led to any changes in HIV testing behaviors and PrEP uptake at Entre Hermanos, which is an organization that provides HIV prevention services to the community, with specifically for the Latino LGBTQ plus community. So our project was really focused on, okay, we have this amazing content that we spent a lot of time developing, specifically developed by and with the community. And so this project was focused on evaluating it and seeing if it really led to changes in behavior.
Wonderful. Thanks, Jane. And Ima, could you introduce your project?
Yeah, sure. Hi, my name's Ahonkhai, and the project that I'm sharing with you today is called Cutting Out Stigma. It is a barbershop-based multimedia HIV stigma reduction program. And so this was really born out of work in collaboration with both community partners, particularly Streetworks in Nashville. This is based in Tennessee, and a cohort of Tennessee barbers. And so the goals of this project were to really address HIV stigma in the Black community, particularly amongst Black men. And we did that in two ways. One was to train Black barbers to be health ambassadors. And the other part was the multimedia campaign. And so our vision really was to try and recreate or really address the stigmatizing narrative of HIV from conversations with barbers in their shops, but also through social media by really leveraging the barbers' social media campaigns in addition to the study campaign, but also other print media that kind of went up in the barber shops, as well as some billboards that went out in the community. So we thought with our team and with the barbers and our community partners about really trying to blanket the community with a different type of messaging around HIV. So that was the heart of our campaign.
Thank you. That's so great, Ima. So we're talking today about both the power and the pitfalls of social media strategies in HIV implementation research. So let's start with the power of social media. So what made each of you decide to use social media strategies in your projects, and what do you see as some of the key advantages of social media platforms? Jane, you want to start?
Yeah, so the idea to really think about using social media came from the community. So this was, the idea kind of started several years ago when, social media was maybe not as popular as it is now, but it was kind of getting more popular and it was being more widely used, specifically in relation to HIV prevention. So really it was Entre Hermanos and my community partners that were like, oh, what about social media? Perhaps this could be a way to really engage the community, to really enhance outreach because it's being much more widely used, specifically by the Latino community. So it really came from the community, and we thought about this idea, and we also, it also kind of developed because we discussed like other campaigns that the community had seen that weren't as culturally relevant, that weren't as, that wasn't necessarily developed specifically for the Latino MSM population. And so this was an idea to think about, can we really tailor the messages that we develop, and can we really tailor our outreach using social media as this really great opportunity to have widespread reach and have people really become more aware of the services that Entre Hermanos provide. So it really came from the community, which was really exciting.
Yeah, I would say we had a similar experience when we were doing our formative work and meeting with barbers in Tennessee. We really first really shifted our focus to stigma because we were hearing things like, I'd rather get shot than say I have HIV. So we were like, okay, we really need to focus there. But also, very, very strongly remember one comment out of those focus groups that came out that was like, we need to repaint it. We need to almost call it something else because nobody wants to hear the word HIV. So from those conversations, we were thinking about, well, there's a rich literature on media and multimedia campaigns for health messaging. And this idea of kind of this parasocial contact hypothesis that you can learn about people or communities that you may not be engaged with through media. But of course, we need to be relevant with the type of media that we're using. So I think ours was kind of an evolution in that way, and wanting to be able to kind of recreate this narrative, repaint this narrative, as the one barber said, but also think about how we are norming behavior, and recognizing that we knew we wanted to utilize these really powerful relationships of the barbers with their clients in the chair. But also, if we're going to actually norm behavior, we have to go beyond those one-on-one relationships or even in the shop relationships. And to Jane's point as well, many of the barbers had really large social media followings. So it was kind of a natural extension of how, how they're having conversations and engaging with their clients. So kind of on multiple levels, there were opportunities to kind of leverage into um, theories about behavior and interaction that already existed, wanting to really think about how we're norming the conversations that we want to have and leveraging the strengths and the assets of the barbers that we were partnering with.
Thank you so much. I do want to highlight a couple things that I think were kind of shared across both projects. I'm sure folks are sort of picking up on the fact that both of these projects were kind of highly community engaged, and really more than community informed, very much kind of community partnered. And there was a lot of thought that went in both kind of on the planning and certainly also on the implementation and kind of execution and to kind of how do we have a true partnered approach to our implementation effort and to use of social media strategies. And I appreciate, Ima, you also kind of highlighting just the kind of diffusion of use of social media in community as well. And so kind of using that opportunity that folks are using social media more and more anyway, and maybe using it even with their clients to also kind of consider how do we make use of this in the context of HIV. Um, I would like to I would like to actually turn to a question we just got in the chat. This is so, did you create new social media accounts or leverage the accounts your community partners had already started?
I can answer that for us. This is a great question because we did both and we could see the difference between, just looking at the reach, because developing a new account, a new brand really is what you're doing. And the amount of work it takes to establish that brand and trust is a lot. So we had, something like a little under 200 followers on our campaign. And the barbers, we had 52 barbers in our intervention. They had an average of 1,050 followers each. So that just shows you the order of magnitude of difference in the amount of engagement that we could get. So that was really important for thinking about, if we're thinking about reach for this campaign, making sure that it's not just coming from us or that there's cross collaboration, et cetera. But very interesting, important question that we learned some great lessons on.
Yeah, similarly, in our formative work, it was really clear that, they wanted messages to come from folks that they trusted, that they knew were part of the community, that understood the community, understood the concerns of the community. So that really led us to have our community partners leverage their social media accounts in delivering the messages and also putting their logo and, you know, information about the organization prominent in the campaign. So that it was clear that where these messages were coming from and to really foster that trust because of the concern and the stigma and the mistrust that was evident in the community.
I just thought of one other thing that was important with that. I think you know, for our since the barbers were not part of a health organization, I think they actually appreciated being able to either collaborate or kind of co-brand that this is coming from a reputable source. So it was really important for them to be able to highlight their legitimacy as a men's health ambassador, since this was a new role for them. And so it was important for us to be able to do that both in person in the shop, which they did. They had like completion certificates from their training, but also online. It was important for them to be able to do that as well. So that was a part of our branding for them.
Thank you both. Can you also speak a little bit more about the specific social media platforms you used and kind of why you chose those platforms?
Yeah, so for us, we did a lot of formative work to ask about the different social media platforms that the community was using, and there was, you know, a lot mentioned. We ended up using specifically Facebook and Instagram, but those weren't by all means like the only social media platforms that the community was using. But we were specifically asking about, okay, if you were to get messages about health and HIV, you know, which platforms you think would you be most receptive to? And they actually mentioned Facebook and Instagram just because, you know, other messaging platforms and other social media was used for other purposes. They mentioned kind of seeing advertisements on like social networking apps such as like Grindr that are specifically for like dating or for gay men. And they said, oh, you know, actually that seems like it's a little too targeted in that realm. So they actually preferred Facebook and Instagram. And we liked kind of that it was, you know, that seemingly quote unquote everybody was using it, and so the messages would be more kind of accessible.
Yeah, we use primarily Facebook and Instagram as well, and I think you know we went where the barbers' accounts were, so there were kind of a smattering of other social media platforms used, but Facebook and Instagram were definitely in the majority.
Great, thank you. So we've talked a bit about the power of social media. We're going to turn now to the potential pitfalls. I won't say definitely pitfalls, but potential pitfalls. So based on your experience in these projects, what considerations, you know, limitations or potential advantages might you want to share for other HIV researchers who are considering using social media strategies in their work? Any challenges that you ran into?
I think we ran into a lot of challenges, so maybe I know we could kind of like bounce off each other, but I want to start off just when I was talking about like the importance of norming, like that was just a potential pitfall of like we didn't want to further stigmatize the community, further stigmatize the issue of HIV, so that we were really cognizant of that in developing our campaign. So I think that's a potential pitfall that, you know, we think any messages that are providing information is, you know, useful, but that's not always the case. So we were really thinking about that prior to even implementing the campaign or even piloting it. And then, you know, there was a lot of potential pitfalls. I think one of the main ones was just because we're using these social media platforms, we're kind of beholden to kind of the rules and regulations of these platforms. And, you know, they change a lot Facebook and Instagram, I mean, like our perceptions and understanding of like policies related to those platforms are very different today than it was yesterday. So that was a big challenge. Some of our content that we had piloted initially several years ago we weren't allowed to post them for whatever reason. So we had to kind of pivot. So I think that was just a big challenge, just recognizing that we're using these platforms that we don't necessarily have ownership over.
Yeah, I think to add to that, who is creating and delivering the messages is an important, consideration, potential pitfall. So think on our team, we worked both with a media and marketing company that is a Black-owned company. The intervention was focused on Black men in Tennessee, and the company was based there and had a lot of experience in health-related media and marketing, which was really important. We also had a communications scientist on our team, and I was humbled by the amount that I did not know about this field. So those were really important just in terms of helping us to really anchor how we were delivering messages. We also had a lot of community input. So all of this everything took longer than than I anticipated it would. So I think all of those were key ways to try and avoid some big pitfalls. And what we heard out of some of our formative work, particularly dealing with Black men and thinking about stigma, like Jane mentioned, was, we really wanted to be careful about how we are framing messages about and for Black men, a population that is often, scripted in a certain way in the media, and we wanted to make sure we didn't fall into any of those traps. Um, and really, we're balancing a difficult tightrope of the barbershop, which is often a hyper-masculine environment, um, and trying to dig into the ideas that we needed to about stigma and phobias that come along with stigma. So I think those were some important ones that we considered. I think another separately, because we had, as I mentioned, we had, barbers who were the implementers of this intervention, and we didn't recruit people based on how savvy they were with social media. We recruited them based on interest. And even though we had some barbers who had a lot of interest and expertise in social media, several didn't. So making sure that we could, um, provide some technical capacity and coaching was important. I think one really big one in thinking about potential harm, it was, and Jane mentioned this too, is like you don't want to further stigmatize anyone, but we recognized, and it happened very quickly, that once Barbara started posting, then people would ask them, are you good? Like, what's going on here? Why are you all of a sudden posting about HIV? And making sure that they were prepared and equipped to handle that conversation and willing to. So that was another really important area of trying to minimize and mitigate like potential harm to our participants.
Thank you. I think, both of you in some ways have spoken to both the power and the potential pitfalls of the kind of potential reach of social media. There's potential to reach a very wide audience, which is exciting and can potentially kind of make health messaging more accessible to communities that might otherwise not be exposed to said messaging. And also, you may reach folks who you don't want to reach. And so I think, yeah, thank you both for kind of speaking to some different dimensions of that dynamic.
Yeah. We have a couple questions in the chat. One is, are you doing any tracking or other documentation of the impact of social media strategies?
Yeah, Facebook and Instagram have analytics that they provide of like how many people have seen your, content, how many interactions, like how many clicks. So we monitored all of that for all of our content, but we also for our project we did kind of surveys of folks prior to the campaign, prior to launching the campaign at our community partner organization. And then afterwards, we also tracked how many people saw the campaign that came to Entre Hermanos that were like new clients, and then assessed, as Ima was talking, like the behavioral determinants of like what about the campaign helped them to come seek services. So we also tracked that and also wanted to see if there was an increase in the number of people who sought services after the campaign. So we did kind of that tracking, and we're evaluating that information now.
Yeah, great. Thank you.
Yeah, on our end, we had some different types of messaging within the social media campaign. There were messages that were created, with all the input that we described, but really created by the marketing team. And there were some posts that the barbers created themselves. So we had like cuts and conversations where they could post, an image of a cut they were proud of, and like and either a video or they could add the text. So there were kind of three categories of types of posts that we're tracking to see. And I mean, it was very easy to see very quickly that if the barbers created the post, and there was more engagement. If there was a video with the post, there was more engagement. So just like Jane, we were really looking at the metrics that these platforms provide to help measure reach, impressions, and engagement, and trying to learn more about best practices as a result.
Oh, yeah, thank you. Another question from the chat. Did you have a designated person who was responding to direct messages if and when you received them on social media?
We did, because our campaign was kind of, we leveraged an account at our community partner. So there was a person who's kind of managing their social media that was responding and also monitoring, reactions or any comments to the campaign. And I think that was important because it would be hard to it wouldn't be as effective to just leave comments not responded to. So.
Yeah, that was, I think, because we had our study campaign that was done between us and the media and marketing team. And then for the barbers, we were just available to them if there were any challenges or concerns that came up from comments in their social media posts.
Okay, thank you. So each of your projects was implemented in a unique context. And we're wondering if you can share a bit about how your project's context, thinking about your socio-political environment, your institutional environment, maybe your community partner organizations, and any other kind of relevant contextual factors, how those impacted your use of social media strategies. It's a big question. I know.
Yeah, I mean, I could get us started. I think, for us, this was in Seattle, Washington, or Washington State. So, a different climate than in other parts of the country. And, but we were focused on Latino MSM, particularly immigrants, to the point about like messaging. We were cognizant of, making sure the content was in Spanish or Spanglish. We used Spanish and English so that it was accessible. And so we were really mindful of that. And I think one of the main issues in terms of accessibility of services is that some folks aren't aware of services, but there also might be a fear of accessing services going to your usual kind of healthcare provider. And so this was really the opportunity. So we really wanted to harness that opportunity of having this trusted organization and kind of linking that with social media, so that we could really utilize that to really engage and ensure that folks were aware of the services available. I think that it could be a little bit challenging in kind of more rural areas because this is an actual site that they would have to kind of come to. People called, but sometimes it might not be as easy to get to if you're in more rural areas of the state. But that was that was something we thought about and wanted to kind of really work with as we thought about the context. I think, today it might be really different in terms of like how we frame some of the messages because the social and political climate is changing so rapidly. And so that's also a pitfall is kind of the ephemeral nature of some of the content that we created. Like the content we created is probably not as relevant today. We might have to kind of shape some of the messaging. It's the sustainability of social media in terms of the actual content might not be as sustainable. So that kind of links to the climate that we're living in.
And what about institutional alignment with your aims, your project's aims?
In terms of the university?
University and IRB. Mm-hmm.
Oh yeah, fortunately we didn't have any challenges. I know other folks had a lot of challenges in terms of using social media and getting IRB approval. That is really tricky. I'll let Ima speak to that.
Okay, thank you.
Yeah, I think that the institutional constraints can be really challenging, and it's not really just the social media. I think for for many of us in our group, it was the combination of social media and community partnership, and I think we all really realized the critical importance of doing this work in a way that was truly partnered to make sure we have the messaging right, we have even the objectives right. And so I think different institutions are more or less nimble in really being having an infrastructure that allows you to do true community partnered or community engaged research. Um, and and then how that's reflected in also like a rapidly changing, like Jane mentioned, um, platform of social media. It just can make it makes everything more challenging. I think for us, the timeline for all of this work was very protracted for all of those reasons, and and I think this is something that I hope that we can continue to kind of put institutional pressures on to change, because I think we all recognize the value of being able to work with communities for research. I don't think that's going away. So I think for us, that was definitely a challenge that we had to work through. I think sociopolitically doing this work in the South, I think stigma, was disproportionately worse in this region, and so that impacted every layer of what we were doing. We often kind of reflected on the fact that we're doing a stigma reduction intervention, and stigma is our biggest challenge. And so that came up at many levels, quite frankly, even at the institutional level. I think like unintended ways of saying, well, oh, this is a stigmatizing group, so you can't do this. And it's like, no, this is a stigmatized group, so we have to do this. So that was interesting. But I think also the example that I raised before about, with the barbers and unintentional harm to them because they might be stigmatized. Um, it was really interesting to work with the barbers and the media to kind of think about even turning that into an opportunity. And one of the ways that came about was even the conversation of I'm good. So what we heard was, in the beginning, it was like, are you good? Are you good? And how are you responding to this? How are you handling this in the chair? And then that turned into like, what does I'm good mean? So the barbers were really able to work together with us to say by the end of this pilot, we're like, okay, I'm good could mean that I know my status and I've taken an HIV test and I'm negative, or I'm good could mean I know my status, I have HIV, I'm undetectable and I'm untransmittable, or I'm good could mean so many things. So it was really helpful to be able to have this open dialogue about the fact that they were having these conversations and pushback, and how could we further message that into something that's helpful for them as individuals and helpful for the community. Um, so I think those were some of the types of challenges uh, that we dealt with on our team.
Thank you. Another question from the chat. How should we budget for this on our grants costs of staff or company to manage? And did you pay to advertise your group's other costs?
I think on our end, social media is expensive. I think people are always like, oh yeah, that person can handle the social media. But if you want it to be managed in a really rigorous way, it is helpful to budget for that to be somebody's role, because otherwise it won't really be done that well. So we had, as I mentioned, we had a media and marketing company who really helped us manage that portion of it. And I think there was another part of the and then we did not do, oh, we had billboards. So we had, our intervention was in Nashville and in Memphis. We just had one billboard in each city that was kind of, that we tried to geolocate in an area that made sense. So those were paid. We didn't do paid ads on the social media platform. So that is a potential option.
Yeah, I'll echo that. We had kind of the social media person at the organization, but we also had kind of someone who was savvy with understanding kind of the analytics, the development of the campaign, managing kind of the surveys that we did when we piloted the campaign. So all of those components we really had to budget for. And for us, we developed the campaign with someone who was savvy with design because we wanted to kind of make sure that it was developed and for the community. So that was a key aspect that we had to budget for as well. So, and we actually did advertise on Facebook and Instagram. So the more money you put in the advertisements, the more people technically that you're able to reach. So that's another aspect.
And were there differences between like posts, advertisements that were posts versus videos? Ima, you talked about videos. Were there some issues that are specific to creating video content?
Um, in terms of, we didn't encounter a lot of challenges with social media platforms for the types of messages that we created, whether videos or other images or text. So that wasn't a challenge for us. I don't know. Did you have that issue, Jane?
So that's a great question because our campaign when we initially developed it, videos and reels weren't as much of a thing. So it was actually mainly static posts that we did. But then this is a different project. We evolved it and then specifically for transgender Latina women. And for that campaign, it was all videos and reels. So again, it points to the sustainability of the content and how, content is rapidly changing. I wonder what will be next in terms of what we're posting, but that was something we kind of had to pivot and really work with.
We have a bunch of additional great questions here in the chat. I want to turn to, I think the next one we have here is, did you iteratively improve the campaigns based on feedback you may have received?
For us, when we initially developed the campaign, it was all static posts, and we did 3 rounds of focus groups where we had the content, we changed it, like the wording of things, the messaging. So we got feedback from the community to make sure it was something that really resonated with them. I will say in our kind of subsequent study when we developed videos, it was we did get feedback on how the content should look and what the messaging, but we didn't, it was harder to you can't kind of film videos all over again and like change the entire script. So it was informed by the community, but a little bit less iterative in terms of being able to make rapid changes.
I think similarly, we did conducted focus group discussions with from different to represent different perspectives before developing the campaign. But we did have a little bit more flexibility to do some iteration once we started. And I think especially knowing the reach that we were getting from the video post that Barbara's did, we really did encourage them to use more of them. And because they were posting them, they weren't going to post things that they were uncomfortable with. So we had to, if there were things that they really had some challenges with, that didn't come up so much. It was more so, oh, we need some variation in this kind of, baseline kind of image on this post. We need to be able to iterate that a little bit. So those were the types of things that we heard feedback about, but then also giving them more opportunity to do some individual posting and making sure that they felt comfortable doing them, providing whatever resources they needed to help um, build capacity there.
Thank you. I think the next three questions have a sort of a thread among them, really focused on strategies that you use to kind of increase the credibility and maybe influence of the information you shared. So if you could both talk a little bit about any identification you may have done of either kind of micro or macro level influencers used in the context of your campaigns, and also any other strategies you might have used to increase the credibility or influence of the information you shared.
I'll speak to, I mean, we didn't use quote unquote influencers per se, but yes, like partnering with the community organization was really key. And I think one aspect of our messaging was emphasizing that the services were free and like confidential. And I think because a lot of the advertisements or posts that you see are trying to get you to buy things or, do things that you might not necessarily want to do. I think it was emphasizing that this is really for you and designed for you and will be delivered in a way that's appropriate for you. And so that was really key to emphasize like the free, HIV testing is free and like you get services for free and support for free. So that was one aspect of increasing the credibility of our messages.
I think for us, similarly, we didn't look for influencers. We recruited barbers based on their interest in implementing the intervention overall. And so the credibility there was in making sure that they felt trained and equipped. We talked about how they completed a 10-hour training initially, and then we had ongoing coaching sessions throughout the intervention. Um, and through that, the barbers also learned about where they could find credible resources so that they could have these conversations in the chair. So they learned about how to fact check and where to go, even though sites are moving and disappearing sometimes now, but they learned about where to go to get credible information. So that was an important part of things. And so since their credibility was the most important, then if someone then comes and asks, well, what is this thing you're talking about? They can respond in a way that shows, well, I got this training and this is what I know, this is what I've learned. So that I think was really important on our end. I think another point that I didn't quite mention and just the phasing of the messaging. Was that we couldn't just come and start talking about HIV or talking about stigma or talking about phobias. Um, so we talked first about we talked about healthy relationships and how like barbershops, barbers and their clients foster these healthy relationships and conversation. So we kind of went from there to health in general and kind of tiptoed our way into the conversations about sexual health and wellness before HIV and then stigma. So I think that was also an important part of kind of gradually entering into this really challenging conversation. Um, that was the approach that we took as well.
Thank you for
As
mentioning. Oh,
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 sorry. I was just going to add to Ima's point that similarly, some of the messages, they were like, don't make it so serious, right? Don't make it like, you have to do this or something bad's going to happen, but kind of like the lighthearted nature that could really engage someone and have them kind of think about the issue and then kind of get them, interested in seeking services.
yeah, thank you so much. I think, both of you sort of spoke to the importance of tone, but also kind of what is the hook and what feels like a reasonable entry point, even if, that entry point is not immediately talking about HIV or sexual health for a particular community or population. I think there's one other kind of piece of a question here in the chat to address, which is, how much did you compensate those who posted?
So we had the barbers were as I mentioned, the implementers, and so they were posting, but they were also having conversations in the chair and referring clients to resources and attending coaching sessions. So we had a group of barbers who did that more intensive set of activities, and we had a group that were more of in a demonstration project. We met with them monthly. We didn't track as much of what they were doing, and we didn't collect as much data from them. And so the range was between $150 a month and closer to $750 a month, depending on how much that we were asking them to do for the intervention. So it wasn't like a pay to post situation. It was really the involvement in the entire package of services that we asked them to do.
And we, of course, I'll emphasize the importance of compensating your community partners, and our community partners were really co-partners, co-leaders of this project. So they were compensated for all their work and time in this project.
Thank you. Do you have any final words of wisdom for us and for other HIV researchers who are considering implementing social media strategies?
I think there were, a couple of things even in reflecting our conversation that keep coming out, and that, who is creating and delivering the message is so important. Telling somebody's story is something that, we shouldn't enter into lightly, and making sure whoever's writing that script, whoever's, shaping that narrative is really equipped to do so in a way that honors the community that you're hoping to impact. I think the idea that there's no one size fits all, and there's no even one time fits all, because what's relevant today may be less relevant tomorrow. Um, but I think the power of the approach still is pretty amazing, and I think one thing that I didn't mention was, like, we had some of the barbers say to us, well, people are not necessarily liking the post, which I think had to do with the stigma, but they would come in and talk to them about it. And so I think even how we measure the impact, depending on what it is that you're seeking to measure or move, may not be obvious. But we had so many stories like this that we realized, okay, something is happening here. And so I think the potential power is really great.
That really kind of echoes kind of my thoughts, because I was thinking about, how we evaluate these campaigns is changing so much because of the changing nature of social media. And I think we think about social media campaigns and their impact, like specifically, let's look at the campaign that we post, and that's the intervention. But actually, I think one of the most powerful parts was actually in the development of the campaign, the how empowering it was for folks to think about what type of messages, how things should look, and even engaging in that process was really powerful. And the folks who were involved in that, I'm sure, kind of shared what they learned and what they thought about, thinking about and communicating about HIV and PrEP, and specifically in the community. So I think a real important focus on the process is really key in making sure that communities are part of that. I'll just share, in like the next iteration, when we were working with transgender Latina women, like they wanted to, in those initial focus groups where we thought we were just going to kind of get ideas of what the campaign should look like, they said, we need to be creating the content. So it's actually really powerful when we inspire and allow the community to really take more ownership and do the campaign, develop the campaign more organically. So I think that's really key in thinking about working with the evolving nature of social media and recognizing that sometimes the power is in that process and not always kind of let's try to measure and say that this was effective because it's changing quickly.
I just want to, I think on behalf of everyone, thank you both so much. I think you just shared so many important nuggets of knowledge and experience and insights and wisdom, and just want to really appreciate everything that you shared with our group today. We're going to pass it back to Allison for a few closing thoughts.
Yeah, I echo those thanks. I learned so much, Jane and I, but thank you. Wow, that was fantastic. And thanks for the wonderful questions from our audience. I continue to love this format because we just get to really exchange and learn and expand our knowledge base. So really appreciate your participation and the fantastic work that you're doing and the insights that you've shared about it. And I also want to thank Tammy and Elena for your expert facilitation. Really wonderful to have this whole event go the way that it did. So thank you all so much. I'm just going to share really briefly one more slide, just so that we can share a little bit of information with you. Get everything right here. So thank you again to our audience for being here today. We hope that you will return for future events hosted by the UCLA 3R Hub. As I mentioned at the beginning, our chats and workshops are posted on our YouTube playlist, which was made by Elena quite some time ago and continues to be one of my most favorite things that we share widely. And also, of course, feel free to reach out to us for any more information. If you're not on our distribution list and want to be, absolutely let us know. We are going to send an extremely brief evaluation. It's like 2, maybe 3 questions, and they're super quick, and we really value the input of those who attend our sessions. So please take like 1 minute, maybe 30 seconds to complete the evaluation. And we hope to see you at future events. And thank you all again so much for being here today. And we hope you have a really good rest of your day and a very good weekend. Thanks so much, everyone. Take good care. Bye.